Hey, I'm Dan Kendall, the founder of Health Podcast Network, and I'm here to tell you if you enjoy podcasts that answer everyday questions about your health, you're going to love the show Your Doctor Friends, hosted by doctors Jeremy Allen and Julie Bruni. On Your Doctor Friends, they tackle the questions you've always wanted to ask, like, am I using sunscreen wrong? And how much protein do I really need to eat? Plus, they bring in their own network of their doctor friends, expert guests from around the world, so you get answers directly from trusted resources. Why spend hours Googling when you can let Julie and Jeremy be your doctor friends? You can listen and follow Your Doctor Friends on all your favorite podcast apps, and you can find those links at healthpodcastnetwork.com/friends. That's healthpodcastnetwork.com/friends.
Hi, I'm Dr. Raj Sundar, a family physician and a community organizer. You're listening to Healthcare for Humans, the show dedicated to educating you on how to care for culturally diverse communities so you can be a better healer. This is about everything that you wish you knew to really care for the person in front of you, not just a body system. Let's learn together. Today, I want to share an episode that continues to resonate deeply with me. It was an episode that I had done with Joseph Seia. If you remember, he hosted our Pacific Islander community episodes, but I was a guest along with him in another podcast. It was a conversation that highlighted insights into healthcare, community, and healing that are just as urgent now as when we first recorded them. My conversation with Joseph talks about truths about healthcare that challenge our conventional approaches. We go beyond medical textbooks, as we usually do, talking about how do we truly create safety for communities that have been historically harmed. Why does the messenger matter as much as the message? And how can healthcare become a form of healing that respects cultural wisdom and historical context? This was recorded for the Student National Medical Association. And what is really exciting, though, is that I love having Joseph on, because what began as a podcast conversation has evolved into a meaningful relationship and partnership. Because now we're working on a program through Oceania Northwest that centers around trusted community messengers to educate the community on what it means to improve their health. So anything we talk about here, my goal is to translate that into community work. And I'm hoping that you get a chance to do that too, whether it's in your own clinic, your own organization, your own department, or something bigger than that. Here's the episode.
Dr. Raj Sundar is a family physician and community organizer in Burien, Washington. Dr. Sundar earned his medical degree from the University of North Carolina School of Medicine and completed a residency in family medicine at Kaiser Permanente of Washington. Dr. Sundar is the host and creator of the Healthcare for Humans podcast. Our next guest, Joseph Seia, is the founder of the Pacific Islander Community Association of Washington. Mr. Seia was born in Los Angeles, grew up on Tutuila and Upolu Islands, and eventually emigrated to Duwamish/Coast Salish territory with his father and his siblings in 1994. Can you tell us more about your journey to your current positions and what made you decide to devote part of your professional lives to advancing health equity?
I got to start probably where I grew up, which was in Tamil Nadu, which is in the southern part of India. And when people think of India, I think they always think of North India. And I'm a proud South Indian. And my grandparents are actually from a little village called Tamrankote. There's like a few thousand people there. But my story starts there because they grew up in poverty where they went to bed hungry. And my grandfather, this 4'8" man, decided we're going to get out of this. And how we're going to do it is we're going to make every single member of our family doctors. So he made everybody in our family get up at 5 a.m. and study nonstop. So when I was growing up, they would ask me, what kind of doctor did you want to be? And I thought that was a normal question for a kid growing up, trying to figure out what my future is like. But honestly, after I came to America and joined my parents, I was in a life of privilege. I wanted to figure out what it actually meant to be a healer and really care for the communities around me. And what does it really mean to fight for justice in healthcare and through a health perspective? So that was part of my journey that led to many projects that I'm involved in. And the podcast you mentioned, it started out just for Washington State, but it's become relevant for all clinicians because you think about how to care for diverse communities. You Google Pacific Islanders, they list a bunch of things, maybe the values they hold. This is how they say hello. And the whole idea of cultural competency is othering, where I'm the standard, the normal person, and let's study these other people. They put people into stereotypes And it's somehow an idea of checkbox. Oh, I learned everything about them, so now I can care for them. But it's so much more complex than that. And that's what led me to reach out to community leaders and ask them, what does it mean to care for you? And try to amplify their voices and make it public for other clinicians. And how do we all become effective advocates to know what that vision is and fight for that?
Yeah, it's good to hear your story, Dr. Sundar. So my name is Joseph. We met through my last post as the founding executive director of the Pacific Islander Community Association. It was through the last 4 years of witnessing the devastating impacts of COVID. We became very radicalized as a community. Prior to that, I think we've always been radicalized as a community. In my early upbringing, I was raised in the Samoan community, Samoan Islands. I was born in California, but my parents were born in American Samoa, and if folks don't know, American Samoa has been part of the U.S. since 1830. So we have deep ties with colonialism and a deep understanding of the colonial project that was happening within the Pacific with the U.S. imperialism, British imperialism, German, all empires that were fighting to control and steal land, right? Steal land from the Pacific, fighting for control of waterway because of their wars. They wanted the Pacific Ocean. And so I grew up hearing from the elders the time of revolution within the Pacific and how Pacific peoples were seen as not human, not able to actualize our civic voices in our own homes. My father had to go through boarding school where he wasn't allowed to speak his own language. And that was a very similar context that we experienced with our Native Hawaiian people, our Kanaka Maoli, our Chamorro folks in the North Pacific, our Micronesian folks that were all part of U.S. territories. And there was this 200 years of colonialism, and we're talking about anti-indigenous policies and sentiments, displaced people, land theft, cultural assimilation. These were all very targeted practices to kill indigenous people. We were told that we were savages, that we worship demons. When we sang, our voices were too harsh for the European ears. They had to civilize even our voices, which is why you now hear Pacific Islanders, when we sing, we sound like Western angels, which was all a process of colonialism. We're talking about a forgotten community. When we get here, there's no provisions for our communities. There's almost an erasure of 200 years of colonialism. And we come here without any sort of structures of health. And so a whole community of people that have emigrated in the last 200 years, and we get up in a diaspora, and then we're lumped in with Asian. So then you have just an erasure. And so for me, it's been the introduction into health. Is it just the narrow idea of health? People were dying from diseases, diabetes. I had two aunties that died early deaths from diabetes, but it was homelessness that was attacking us first. It was food insecurity that was attacking us first. It was all of us and my siblings and all the young people in my neighborhood was put into the juvenile systems. Those were the first systems of unhealth that we were coming up against. My work actually didn't start with public health. It actually started with the carceral system. I also started with the police killing of Pacific Islanders. When they actually disaggregated the numbers of police killing of Pacific Islanders, they saw that it was actually the highest recorded percentage of how many people in a community compared to the population were murdered by police. So those were all things I had to consider and expand my work around health. And that's where we've entered. And of course, we came up to then the public health system through COVID, the same systemic ills that is within the carceral system, educational system, food security system. It's in the public health system. And our healthcare providers are not much farther along. And so for my grounding, it has always been, how do I bring forth the numerous stories that I've grown up with and the stories that I continue to hear about my community? And what is it that I do to prepare myself to then engage folks that have locked us out of decision-making, that do have political power to change laws? How do I then communicate to them in ways that allows them to then open up some of those doors, open up some of those resources so that our communities are able to access them? So it's a little bit about me.
I'll add that I got a crash course on the Pacific Islands from Joseph when I did my podcast with him. I knew some, but didn't know as much as I should, taking care of a lot of Pacific Islander folks because there was a bunch in Washington. They come to me for care. Because when we talk about culture, we talk about competency, which is these patterns of worldviews, values, beliefs, the things that maybe there's some commonality as a group of people, but we never talk about the power piece of it. And we think about how do we make healthcare safe for different people. It's both patterns and power. And power is about historical context of imperialism, colonialism, and what has happened in the past. And what's the current power dynamic, what's leading to continued worse health outcomes for certain groups of people. And we need to understand that piece because sometimes we ask these questions, right? And I know you're going to talk about this, COVID disparities. And people's first thought is, hey, Pacific Islander people, maybe they have higher rates of diabetes, maybe something about their cultures and their values and beliefs that's leading to these decisions that puts them at higher risk. When we stop there, when Joseph talked about the homelessness and all these other facets because of the historical harm that we've done as a country or people, and connecting those dots lead to different solutions and interventions rather than saying, oh, Pacific Islander people are overweight and have higher rates of diabetes, and that's why there is a COVID disparity. And I found that over and over in the healthcare context, at least, of people trying to narrow down the cause of something so profound and deep into simple in a healthcare context.
People expected Pacific Islanders to not want to advocate for themselves and have a voice, and how you're actually trying to hold a baton towards doing that. Now we're mentioning COVID, and we know that as COVID ravaged the United States and the world, we began to have more of a mainstream conversation on some things you guys have already touched on, which is health equity and inequity, as we also saw a disproportionate number of people of color, lower income individuals, and just elderly individuals were just dying from the disease. And you've also already touched on some of those structural inequities that have exacerbated then those COVID inequities in both your communities. How would you further expand on those historic natures of those inequities that you almost began talking about, Dr. Sundar?
Where do you want to start, Joseph?
Yeah, I was really impressed with a lot of the organizing work that our Native Indian, Native Alaskan community has done to take charge of their healthcare systems and to build healthcare systems that are infused with their own values, their cultural beliefs, and also to acknowledge the health work that our Indigenous elders have been doing. Those that are traditionally seen as healers within our communities are not honored by a healthcare system based in Western practice. When we know as Indigenous people that healing takes place in the context of an ecology, right? When you have an ecology that you live within, everybody in that system matters, right? How do we support the work that is already done with communities? Because as these healthcare systems and public health systems are failing our people, guess who's doing the health work in our communities? We are. And we're doing it for free because the neglect that we've been facing as a community. And so how do we bring those elements in, right? Those natural sort of care elements that already exist within a community. For example, in the Samoan community, elders are seen as basically queens and kings, right? So we honor them with the utmost time, respect, the resources, the best things that we have within our families. Train a person to be the steward of that elder. Every elder is paired with a position within our family, and that person in our culture is the one that is then assigned to that elder till they're dead. In our culture, that's just a natural element of our culture, but they're not getting paid. They're still having to either go to school or do all the other things while being assigned this cultural sort of position to take care of this elder. And our system does not have a way to actually honor that labor, that free labor that happens within Indigenous communities and many communities. I know lots of Southeast Asian communities have similar practices. South Asian communities, African communities have similar practices where we have health practitioners that are already within our villages. And so the system that doesn't actually accommodate for those practices, right? And then I look at my Native American communities that have fought so long to have particular federal funds so that they can have their own community health centers. I go to the one in Eastern Washington in Spokane. It's one of the best community health centers I've been in. You walk in there and there's a sense of hospitality, sense of culture. And there's a difference between me walking into a health center here. And when I'm assimilated, my dad refuses to go into a hospital because he feels like it's a racist system. They don't see him. When he talks, they don't hear him. There's an assumption about, and this is a huge thing with Pacific Islanders, I've heard Pacific Islanders say over and over, is that they think we're dumb. They literally think we're stupid. So nothing that comes out of our mouth is seen as intelligible because of these strong beliefs that our communities are so othered that their decisions about their lifestyles are not logical. There's this assumption that we're continuing to kill ourselves. It's a whole system. It's not just individuals within that system that believe that. If you don't have something that's set up where bias is eliminated, you're shit out of luck. Right? So all we can do is teach these healthcare systems how to do harm reduction work. The positive side of it is I have seen tremendous work that has been done within Native communities to take their own health into their own hands and deliver it well to their communities. And we see that with the COVID rates were the highest amongst our American, Indian, Native, Alaskan folks, right? Because they knew how to reach their people. We got the message from them, and we actually had the lowest rates to start with. And then we got the message and we were radicalized into getting the COVID vaccine to everybody. And we actually ended up having the highest rates of COVID vaccinations. And there was this assumption that our people were anti-vaccine. Let us have the resources to actually create a space for people to feel welcome, and we'll do the work. That's what happened during COVID.
The solution is, as Joseph was saying, give resources to the community, give power to the community, and the autonomy for self-determination, figure out what it looks like to create a healing community for themselves. And we have not done that. And that's something to advocate for. And some people with power to hold to that vision and make it happen. Because we're going to be leaders in healthcare. And sometimes I think we limit ourselves to the vision because we get stuck in this healthcare system. And what optimizing looks like, what quality care looks like is just making sure we hit the rates of getting pap smears and colon cancer screening. But it's so much more than that. And the second part is relationships. People are going to show up to you and want to be cared for. And Joseph mentioned this too, and they don't trust you. And trust, we can talk about so much behind trust because there's all this historical harm. Obviously, they don't trust because of that. But also we continue to do things that are actively making it so we can't be trustworthy. So yes, there's this implicit bias that we all need to get in check, and that's work every day and being mindful of what you're carrying around with you. But sometimes we're ignorant. We don't know the history of the Pacific Islander people or Native Hawaiians. And I use this example a lot because it really resonates with folks that when at least where I'm from, right, in Washington State, and Native Hawaiians have traveled to different parts of the country, but there are a significant amount of Native Hawaiians in this area. And people walk into the clinic room and then they're desperate to connect with this person who they've never met. And they talk about their vacation in Hawaii because somehow then we can relate about like this land that you're part of, but completely miss that for some folks, they were kicked out of their land because of tourism. And here you are talking about, yeah, hey, vacation was so fun. Isn't that place really cool? Because we didn't do the work to really understand the context of this community, of why they're here, what their history was. So we are actively making them distrust us because now how are they going to be vulnerable and trust all your recommendations?
Right.
And then we're sometimes actively harming people too, even outside of encounters like that. So I have people that are A1Cs like 11.5, uncontrolled diabetes. We try to outreach them. We say, hey, we need to get your diabetes under control. Maybe you should take insulin. And they say no. Hey, we give recommendations. They're not really listening. That's all. We'd stop at that. When there's so many ways to heal a body, and the cause of why their A1C is 11.5 is really complex, and we do such horrible job of incorporating indigenous way of healing that we don't even acknowledge it. And we can take diabetes off the table, even with back pain, right? Thinking about touch as healing, and what does that mean for you? And like, how can we incorporate that into our recommendation plan? Again, that's so limiting. Joseph's going to be like rolling his eyes. Yeah, that's going to get our community better. But anywhere, even in the moments where we could connect, they're made an appointment, they're showing up to you because, hey, like, I'll give this a shot. And then we fail in that encounter. So then, of course, not going to come back to you when COVID's raging and you say, hey, come get this vaccine.
I'm grateful that you actually already spoke about the perspective from a family physician standpoint, how your patients and how you were able to see head on these inequities, like mentioning the fact that we see Hawaii as a vacation spot, but for some people, like this is literally their livelihood. At the same time that we were grappling with the onset of the COVID-19 pandemic, we also continue to live in the pandemic of state violence and police killings of unarmed Black and Brown Americans. And so how has state violence impacted Pacific Islander communities in Washington and just elsewhere on the West Coast?
Yeah, it's been a very interesting question because during COVID, there was some strong incidents that were happening across the nation that Asian elders were being victimized. It got all the way to Congress. And then there was resource provisions that were targeting API communities. It was a very interesting time for Native Hawaiian Pacific Islanders because We have completely different lived experiences with our East Asian brothers and sisters. There was a lot of money that was being funneled to try to understand the manifestations of state violence or violence within our communities. I was a part of a study through Washington State University, and I made sure that whatever work we were doing, we were going to study the manifestation of violence differently for Native Hawaiian Pacific Islander communities, apart from our Asian brothers and sisters and the ways that they experience violence. And largely for our communities, we haven't produced the research yet, but we have a lot of folks that have been victims of gun violence, been victims of police-involved killings. During COVID, there were 3 killings of Pacific Islander young men in Spokane by the Spokane Police Department. There were 2 killings over there in Clark County by Clark County Police. We actually started our organization, the Pacific Islander Community Association, after the killing of one of my friends by Seattle Police Department in 2018. That was the founding of our organization. Our communities, Pacific Islanders, Micronesians, Melanesians, Polynesians, have historically experienced state violence, whether it's within the territories, the bombing of their islands, the testing of nuclear bombs. And then the U.S. government then decided to send scientists to study the fallout of nuclear poison on human populations. Let's not forget that is the biggest human subject study that the U.S. has ever conducted on a people, was conducted on Pacific Islanders. And so there's no trust coming from back home and then ending up here and having a very intense relationship with local policing, right? That has never been resolved. One of the biggest cases in the U.S. was with the Samoan family, the Dole family in California, against the LAPD, where the LAPD decided to rally their whole troops against this one family that was celebrating a baby shower and assaulted everybody in the family, an extended family. And they had won $24 million, the biggest lawsuit settlement against any police department. This was specifically with Los Angeles Police Department. And with it, like, there's PTSD in our community with police violence. But it's funny because Pacific Islanders, because we've been erased for so long, oftentimes they don't actually speak out, speak up, organize. We need to also figure out a way to engage these systems and basically organize with police accountability work, right? And not just with the state of Washington, but with the departments, the county departments.
That's a great segue into my next point, which is talking about the podcast episode that brought you guys here, Pacific Islanders. What does erasure community mean? You guys dove into a lot of interesting topics, including the current discourse on cultural competency. Can you guys expand upon that more, specifically just the specific, separate, and interlinked definitions of cultural safety and power?
I think we can keep building on this conversation on what is our goal as you become doctors, and what are you setting out to do? And we hold a lot of power. And you need to use that power in a way that's helpful for folks. We need to be able to amplify those voices rather than think we have the solutions. So the cultural safety and competency, I told you about the limitations of the competency model, and really moving towards safety means that you're focusing on how do you create environments for psychological, physical, and emotional safety. You're going to understand that you need to learn a lot more about the communities that you're serving to create that context. Focusing on the healing relationship, because you'll still end up in places where you're caring for the community one-on-one, in community contexts where you're going to have the power to speak up and advocate and amplify their voices. And understanding the history of what happened helps you move towards that goal of cultural safety, so you're not othering the entire community. As Joseph just talked about API community in quotation marks, because somehow the entire continent, along with different islands, got lumped into one category. You should know the difference between Pacific Islander and other Asian Americans, Chinese, Indians, but you should also know there's actually a bunch of different Pacific Islands. And you should know about the harm Bikini Atoll has caused and in the Marshall Islands, and why they have higher rates of thyroid cancer and other types of cancer. Not just so you can increase the rate of screening for them, but what does it mean to actively undo that harm for that community and support them?
You see that's important, which is just knowing the specifics of every person, every community, and not just the broad strokes. It doesn't really call attention and honors other people and their own culture.
I think about, why do people feel unseen, unheard, and unknown when they show up to our healthcare system? And I still want to say the best solution is giving people autonomy to create their own ways of healing and the power and resources. but they feel unseen and unheard because we don't know them, right? We don't know their community background, their context, or themselves. So if somebody comes in with depression, our automatic thought is, hey, you want to try this SSRI, this medication that'll make it all better for you? If you understood the police killings and the violence community is going through and connecting at that level, not saying you can solve it, but that's happening. And there's more space for that conversation to happen. The solution is something completely different rather than prescribing a pill and calling it a day and then saying, wait, they didn't adhere to our recommendation. They didn't want to take the pill.
And what do you guys personally see as our greatest challenges with that? If you could shape future conversations and direct future initiatives to address these issues, what would they be?
The vast disparities that are happening in the Black communities and Native Hawaiian Pacific Islander communities, whole communities that have been underinvested in for the last decades, right? One of the biggest things that has been coming up is really what happened with COVID. There was nowhere for Pacific Islanders to go to when there was this disaster, emergency situation that was happening, right? There was nowhere that felt safe. Even when they were opening the first vaccination lines, right? They were opening it up at Seattle University, up north and downtown. If it wasn't for me, because I was looped into some of the access there wouldn't have been any Pacific Islanders. The most impacted community, there would have been 0 Pacific Islanders being vaccinated at those first lines. And we get there, and what does it look like? My people felt so out of place, even though we were the most harmed communities. Intentionally open up these vaccination spaces and places where none of us had access to it. So I say this to say that I love your explanation, Dr. Sundar, around safety, right? That we have to create safety. Also, expanding on safety, it's a sense of sovereignty, it's a sense of autonomy, it's a sense of where do you feel belonging and how are you drawn to that sense of belonging? Talk with Dr. Sundar about this. If you're going to make an appointment with me, medical appointment with me, good luck. Yeah, well, good luck with me. How do you take the culture of a people, the mind of a people, the spirituality of a people, and create something that actually works? And so a lot of our efforts have been walk-in efforts, right? Creating spaces of culture and hospitality that actually you walk in there, we're playing music people are familiar with. We're also providing refreshments that people would like. How do you then get it into the minds of people? Because we know that the number one obstacle for impoverished and poor communities to address something that they're going through as far as health or whatever it is the distance between them and the resource, right? If there's a long distance, if the referral process is a process where you have to go to point A to point B to get to point C, you're lost. You're lost before you get to point A. But if you actually create cultural hubs that has everything resourced within it, and we know that this is working for communities that are experiencing houselessness, for our folks that are experiencing substance use disorder on the streets, right? We have to create these centers that are actually furnished with doctors and social workers and cultural practitioners, something that's like the Seattle Health Indian Board. They're creating this beautiful modern downtown because we know that Native Americans have the highest rates of houselessness. And so they created this hub where Native American folks can just enter, right? And be able to access whatever care that they need to access. And so the people that will naturally be drawn to there can hear languages being spoken, can see their elders. And so it's already a targeting place, right? You don't have to necessarily do any policy work to make sure that you're reaching the community that you're trying to reach.
Joseph, I loved all your examples. So how can we overcome that and get them to fit into our system rather than be self-reflective and say, okay, these are the beliefs and values we hold. This is also happening in the community. How can we create a system that actually meets their needs? Joseph just told us the answer of what it should look like and what we need to create. So then our job, healthcare, physicians, doctors, whoever, is to make the change happen. And sometimes we get stuck there because we also are burnt out and have a sense of powerlessness. So starting small, and I try to use the community organizing framework because that's what keeps me hopeful that change can happen and keep moving forward, which is how do we use the resources we have to turn it into the power we need to make the change we want, right? Finding what we have already, strategizing how to turn that into power, and then making that change. And it can be specific. Right? I'm going to organize around creating walk-in clinics for this community. Let's strategize on who we need to get in the room, what resources we have, and get creative.
I think it's a great way to summarize what are the greatest things we should be focusing on when it comes to pushing forward health equity you alluding, Joseph, to access and creating that safe environment. Who come in, and then you, Dr. Sundar, talk about taking what we have and just utilizing it, even if it's not everything, right? We have something. As we come to a close, there are many training and future physicians and just other healthcare workers that seek to be great stewards of the health and well-being of their patients, families, and communities.
Yeah. So there's a sustainability factor, right? So that has to come into place. You have a community that has been underinvested in for decades, centuries. There's no resources there. So even with the COVID pandemic, these were very short-term fixes that were coming down from the federal government. We really saw COVID as a window of opportunity, as sad as it was, because our community was dying in the highest rates. But we still also saw it as a window of opportunity to try to get in there and be seen in the community and to create pathways where we were able to have places to co-create policies, health policies that are for our people at the federal level, at the local level. Other issues like data sovereignty, right? That was a huge issue for our community as well. Like, how do we make sure that our data matters as these state governments and these other governments are telling us that we don't matter because our percentage is small? We say, no, we do not like your data collecting tools, data analysis tools. You need to create better tools to actually look at the health of smaller communities. Like Sundar was saying, federally qualified health community centers have been the life-saving alternatives for Native communities here. We have those in place for our Pacific Islander communities that were territories of the U.S. If you go to a territory or a previous territory of the U.S. in the islands, you can get healthcare that is funded by the U.S. But if you're a Pacific Islander living here in the States, good luck. It's built within the DNA of these institutions to continue to perpetuate these vast disparities. We have to look at how to create powerful cultural hubs, health hubs. And then for doctors to consider maybe taking that so that they can work and support these initiatives. We only have one Pacific Islander doctor in the state of Washington, and I know him personally. He is my cousin. He's over there in the Silicon Valley, and he runs a hospital. But how do we pay that guy? How do we make sure that he can feed his kids and his wife and sustain his home, but still be able to use his talents and invest into building a culturally sustainable, a place where people feel belonging within the Pacific communities that honors all of the things that make us unique. And he's even told me, Joseph, I really want to do this, but I'm like, let me go find the money. My advice is continue to look at the ways that institution has policies, create and continue to foster those disparities. And then also there's a lot of Pacific Islanders that might be working at your health centers that you might not know. Look at the service workers that are there, look at the folks that are caregivers, right? Build relationship with Pacific Islanders that are within your communities already. We have a lot of Pacific Islanders that are taking care of elders, that are working.
I second that. I think this is all true, right? The vision is right there, and he told you exactly what the community needs. And I want to say a few things. One is that if you're listening and you are in your learning journey, that this problem is so much bigger than you with healthcare structure and all of that. But it doesn't mean it's an abdication of your responsibility to change it or find ways to advocate to change it. And that could be your mission, not just in and out and maximizing your retirement, right? A lot of doctors do that and they try to think about their own family, but we need to be better than that. The second part is reflecting on what does it really take to build a healing relationship that's based on trust? And what all do you need to know about the person and the community so you don't place the burden on the patient to educate you on all the things that's happening and what's important to them. And I know there's a lot of Indians in Fiji now, like tons. Like when I'm talking to a Pacific Islander, they always do a second take, but now I knew, I'm like, hey, I know there's a lot of Indians in Fiji. And they're like, yeah, are you from Fiji? I'm like, no, like I'm not, but I know. Like you were thinking that because we were talking and you're like wandering that. Right? Like there's these micro moments of connection. And then I also understood like so many things that feel really important. And I think, Joseph, you talked about this. It's about the spiny starfish has both the poison and the remedy, right? The idea that you have the solution to your own illness or what's happening in your body. Mm. And I try to utilize that to get my numbers better in control with diabetes. I'm just saying, hey, this is what I have, but I fully trust you. Now, I've heard this phrase, you may or may not know about this in the Pacific Islander community. Does that mean something to you? What does it mean? What should we work on together? There's a different approach to our relationship when people come to me rather than this algorithmic way that we typically approach patients.
looking at the cultural tools of communication, right? Which was actually a huge project that we did for COVID about what does it mean to, Samoan tradition, we say fasavali. What does it mean to put legs on a message, right? And in the cultural context of Pacific Islander communities, you cannot talk to an elder any type of way. There's a very specific way of approaching elders by your neighbor, right? Somebody has to put the legs on the message. And it's, for example, you go and you have a disposition of humility, right? And there's protocol about how that message then delivered to the person that's receiving the message. That's not protocol within Western society. And so there are all these nuances. And then another nuance too was that we knew that people listen to our elders. So one route of doing cultural communication work with COVID was to give all the information to the elders. So then the elders are the ones that are the stewards of the message to their own families. For our indigenous communities, the message matters, but the messenger matters more. Mm-hmm. For Western medicine, it's just the message, which is a worship of the word, which is a very classical way of doing intervention work that doesn't work for us. Because for us, actually, it's the messenger that matters. And so how do we then honor the messenger of health, and equip the messengers of health within our different communities to then arrive at a different outcome? You can do all the work as a non-Pacific person to do healthcare, but you also have to partner with Pacific people to steward care of Pacific peoples. You cannot steward my care if you're not actually in relationship with another Pacific person that is also helping you in stewarding my care. That might sound tokenizing to people that are so used to this colorblind way of doing medicine. And then the last thing I should say is that there was a story that this Samoan doctor told me about the Samoan woman that was a patient to a doctor who then told her all these things. Their level of diabetes was so unhealthy that the doctor was like, you're going to die if you don't do this. And the Samoan woman told him that, actually, I'm going to go to Samoa and meet with the traditional healer. The doctor advised her against it. You're going to die, whatever. So she leaves, comes back 6 months later. She's healed from diabetes. And the doctor's, oh my gosh, what happened? Oh, I met with the Samoan Fufu. And then they were like, what did the Samoan Fufu tell you to do? You shall only eat of the fruits of this land. You have to walk to the mountain once a week. So there were all these sayings prescribed by the local Fufu or the local Samoan doctor that actually helped her heal, right? But she was able to hear them, right? And there's such a little value of the messenger and the nuance that the message has to be communicated, that people are just missing it. Dr. Sundar just said, how do we incorporate in the traditional understanding of people to help them understand how to take care of themselves? That saying is, if a fo is the crown of thorn, starfish, has both poison and also both remedy. It's someone saying to say that healing is within our body, that healing is already within our mind, within our body. And if we can only listen to our ancestors, to those around us, to find those healing messages to help us along, we would be able to access our own healing.
This is such a wealth of information, and I know our listeners are going to highly appreciate this advice you guys have given them. I especially love the whole aspect of the messenger being such a vital part to a patient's journey of healing. I'm grateful that you guys have shared this with our listeners.
As always, thank you for listening to Healthcare for Humans. If you've found any value in this podcast, I have 2 quick requests. 1, please leave a review in the podcast app that you're listening to my voice in right now. It really helps others discover the show. 2, share this episode with anyone who you think might benefit from it. For easy access to all our episodes and to support the podcast, visit www.healthcareforhumans.org. There you'll find our content clearly organized by topics, countries, themes, to help you choose what to listen to next. Until next time, this is Dr. Raj Sundar, reminding you that culturally responsive care leads to better patient outcomes. See you again soon.